And again, I apologize if this looks a little wonky. So we have some good information that we're going to be covering today. So I'm going to get started and I will pause just in case you guys have questions with some of the topics and information that we're going to be going over. So we will be looking at, I'm going to share some reminders, some resources, education, and takeaway with the meeting today. So first, some important reminders. If you haven't already, please register for the 2024 Fall Convention and Expo. Registration closes on the 4th. We were able to get the room and block extended until next Monday. So if you have already registered, awesome. Now reserve your room at the Allstaff. And if you haven't yet registered, please do that before the end of next week. We have a dedicated assisted living track at this year's convention. So we have BAL coming to do an assisted living workshop. We have tracks on everything from emergency preparedness, managing difficult conversations, workforce threats, how to identify them, how to mitigate them, how to be proactive against those threats, marketing, recruitment, retention. So there's a lot of great information for our assisted living owners and operators and staff. So please attend this event. And another important reminder, because we love to celebrate successes, please nominate your shining star by tomorrow. Registration closes at end of day tomorrow. The information is on our website. You can nominate people in categories of leadership, director of nursing, direct caregivers, and support staff. So truly any individual that works in your facility can be nominated for this. Do not hesitate to nominate leaders where they stand, and do not hesitate to nominate the support staff, including your business office managers, your dietary staff, your facility staff, your maintenance staff, laundry, janitorial. They all make your operations run, and it's a wonderful opportunity to recognize them. And very importantly, focus specifically on WCCEAL, your third quarter quality improvement variable next window. So Q3 reports, the submission window opens on October 1st and closes on October 15th. You can obtain the form now, you can complete the form, and on the morning of October 1st, you can submit it. It is so important to maintain your WCCEAL status and active status, and hopefully achieve or maintain your gold status by completing this task. If you have any questions, if you need any help, if there have been staffing changes and you need to get in, please reach out to Taylor now. Reach out to her before the 1st so that you have plenty of time to complete that Q3 QI variable form and get it submitted within that window. Having looked at participation rate, I wanted to share briefly some membership reminders and refreshers, just to ensure, that there's individuals that have been part of WCCEAL since its inception, and I understand that there's turnover and changes and things that are happening. So I just want to make sure that you, your staff, anybody that may be new to your facility has this information. All of this information is online, but I wanted to just briefly touch base on this this morning. So to be an active member of WCCEAL, there are 2 things that you need to do. One is return at least one resident satisfaction survey. So that needs to be done annually, and that needs to be returned by April 15th. Requirement number 1. And then the second one is simply submitting your QI variables once each quarter. The very first time, if you are a new member, or maybe you had some staffing changes, or maybe you're just looking to, take some time to review the information. That first time you submit a QI variable, it might take you 10, 15, 20, 30 minutes. Honestly, each quarter after that, it takes you just minutes to review it. And now the next step, because this is the goal that we have for our members participating in WCCEAL, we want to help you achieve and maintain gold status. You can start to achieve that after just successfully completing 2 quarters of membership participation. So through that, you just need to do an extra step with each membership requirement. So first, simply submit your QI variables and then review the reports. Pull that data, look at the data during the window. There is a dedicated window where you can go in and review the information. We will make sure that to remind you, Taylor is awesome about sending out information and reminders. The information is all online on the WCCEAL Inequality website. They have a great little like chart that does update based on the current date and what the requirements are. So you can kind of look at the little toggle and see, what window we're in, what's happening right now. And there is also a wonderful checklist that you could print off and just have to make sure, yes, I submitted my QI variables. Yes, I remember to review them. So, and then, okay, beyond the QI variable, you just need to have a 25% return rate on your resident satisfaction surveys. That means is, let's say you generate 10 surveys. At least 25% of those surveys need to come back. So at least 3 work to achieving and maintaining. And then obviously you need to go into the database and just review your satisfaction survey reports. So if you are a single facility owner and operator, you can see all the information just for you, and you can compare it to your peers within YCAL membership, and you can compare it to your peers within all of the WCCEAL program. So really, it's just you're doing what you're already doing to be a WCCEAL member, and then you're just taking that because it is incredibly helpful, and we'll get into that in a little bit. But I want to make sure that you have that information because it's going to help you improve some metrics that we're seeing out there with regards to falls and rehospitalization rates. And next, we've seen this question because we know it happens. How do you get out of suspension? Suspension sounds kind of scary. It's not as scary as it sounds. It just means that one or more of the WCCEAL membership requirements were not met. So either you missed a couple quarters submitting the QI variables, maybe a satisfaction survey was not provided, but there's ways to get out of that status. So just keep submitting QI variables every single month. Let's see. Okay, Lana, I'll ask you that. We'll get to that in just a minute. I'll go through and answer all the questions. I saw that came up. So to get out of suspension, what you need to do is just to continue to submit QI variables. So generate that report, make sure you submit it during the window. And then during the next satisfaction survey period, you will be able to generate satisfaction surveys, distribute them, and have them returned. So that will ensure that you are out of suspension. So we are in Q3 right now. So if you are currently in suspension, submit QI variables for this quarter, submit QI variables for Q4, submit QI variables for Q1 2025, and get at least one resident satisfaction survey returned by April 15th. You'll be out of suspension, and then you will have complete access to all of the information. You can then see your reports. You can then see all the other data and information. Because we know this happens, right? You have staff, there is a change in staffing, there is a change in management. And then again, you get busy, so things can happen. Ways that we can help you with this: add my email address and Taylor's email address to your safe sender list. You could contact your IT department and just say, whitelist our emails. That will ensure that you get the communications that we're sending, so it doesn't get filtered into your spam or your junk. Because we do send out reminders every quarter. That information is also provided in our weekly e-newsletter. We just want to make sure that you stay on top of that. And if it does get close, you're going to get a phone call from us, because again, we want to make sure that you are maintaining active membership and that you also are able to achieve and maintain gold status. Because there's great benefits that go along with that. And that includes regulatory flexibility, like an abbreviated survey, eligibility for discounts on your liability insurance premiums. Obviously, then you have that public recognition of participation through the WCCEAL website. It is identified who participates in the program and who is a gold member. You also get free access to the Clinical Resource Center. You get access to information like this, the education that we provide. And then also there is the MCO Pay for Performance Initiative. One thing I forgot to mention is at Fall Convention, we do have a financial/reimbursement focused session that will be covering both assisted living and skilled nursing reimbursement, financial type questions, issues, updates, and trends. And so just as a reminder, with the MCO Pay for Performance Initiative, there was a new initiative that was added this year. And that because of your WCCEAL participation, there's benefits from that. So whether it's through the Initiative 2 criteria, Initiative 3 criteria, because you are in WCCEAL, there is a financial benefit for that. Again, this information is available online. I know that this can be confusing, so I am working with some experts on this that we can put together a pre-recorded, like 15-minute video webinar to kind of explain this, address some questions and issues and challenges that we are seeing. And then hopefully it will open up conversation to make sure that you are receiving the benefit of this, because that is what we are here for. We want to make sure that you are benefiting from your participation in WCCEAL to its max capacity. So for the first few steps with the refresher, with some of the updates, do you have questions? Feel free to unmute yourself and ask them. Can put them in the chat box. I hope I answered the question about the suspension. Again, if you have questions, if you don't want to have them addressed right now, email myself and Taylor, and we can walk you through the process individually. We can also set up training, refresher training with you, your staff, anybody that may be new or have questions. That is what we are here for. We want to help you be as successful as possible in this coalition, in this program, because you deserve that and your residents deserve that. Let's see. It looks like we have a couple people in the waiting room. I want to make sure that they can get in. Okay. So focusing specifically on WCCEAL and WCCEAL performance and WCCEAL data. First, I am part of a work group with Leading Age and WALA. We are reviewing with a focus group updates to the QI variable forms, not only updating the form layout, how it appears, but also the data that it's collecting, its impact on providers, the necessity of the information, and then also expanding some of the, there we go. And also expanding some data that should be captured, including education, either education that you need, education resources that you would like to see more of, education that you are hosting on your own or participating in, and also a section on customer care. We are also ensuring that the WCCEAL program overall is tailored to all aspects of the assisted living sector. So that includes obviously the RCACs, the CBRFs, the adult family homes, our sector that cares for and supports individuals with intellectual and developmental disabilities. We want to make sure that the entire sector of assisted living is supported through this program, has the data that they need for this program, and that the questions that are being asked are applicable to the demographic that they support, the acuity, again, like the population. So we will be sharing this information as a whole with the WCCEAL Advisory Committee next week. And I believe the next step will be then submitting the proposed changes to all WCCEAL members so that we can get your feedback to ensure that when the changes are made, it is in favor of what is needed by our providers. And then beyond that, the next step will be reviewing the resident satisfaction survey. We have already had discussions about improving the process of returning the survey because we want to make it as easy as possible for you to not only generate that survey, but ensure that that survey comes back. So we are developing a better process for that. And then we will also be looking at the survey data itself. So between now and the end of the year, you'll be hearing from me with some questions about how we can best improve the resident satisfaction survey. And even proactively, I appreciate any kind of feedback, constructive criticisms, changes, whether it's related to the QI variables or the satisfaction survey. If there's information that we should be collecting and focusing on and it's not there, let us know. We want to make sure that this serves you in the best way possible and that it's applicable to your processes, your care plans, your operations, and importantly, truly reflecting the great work that you do and how you care for the residents that you serve. We do talk a lot about celebrating successes, and with that, we also have to focus on areas of improvement. So there have been some concerning trends over the last 2 years, and I just kind of want to focus on them right now so that we can help change the path that it's on, by the end of 2024 and going into 2025. So there has been a continued increase in falls and hospitalizations, rehospitalizations, consistently over the last 2 years. So going back to the data from 2022, current quarter, falls have increased and hospitalizations have increased. And our PEAL YCAL members continue to have higher rates at both when compared to all WCCEAL data. So when compared to other association participants. So as you can see, fall rates are increasing. This quarter in 2022, the average fall per 1,000 resident days was 4.09. Last quarter, that was 7.06. So that's a little bit of a concern, and we want to help figure out why and help stop it from getting any higher. We want to see that lower. We want to try to get that below 4 and then work on getting that below 3. Hospitalizations. So there has been an uptick as well. This quarter in 2022, the hospitalization rate per 1,000 resident days was at 0.85. It is trending upward to 1.38. So, what do you need and how we can help? Those are two important questions. So we need to reflect internally as an association to see where we're failing and how we can best serve you and support you. And second, we want to spark some ideas so that hopefully we can see an improvement next quarter and then an improvement in Q1 of 2025. So first, from the facility perspective, try to do a root cause analysis. Maybe you're just going to focus just on falls right now. What are the issues? Because once you can identify issues, then you can start working on solutions. So things to consider. Are there environment modifications? Are there technology solutions? What are your communication practices? How effective are your communication practices? Review your safety protocols. Make sure your health monitoring systems are working properly. Maybe that that can kind of go along with technology solutions. So really take a deep dive. Please pull up your QI variable, look at what you are trending at, try to kind of see, okay, we know that there's this issue. Now that we've identified what the issue is, maybe it's an environment modification. Now let's try to find a solution that is effective in changing the outcomes. Also, review your staff education and training protocols. Obviously, we have a wealth of in-person training, whether it's in-person webinars, workshops. We have a whole database of education. We try to offer as much as possible. Also, our national organization, NCAL, has great resources, education, training. The Clinical Resource Center has great webinars and education and tools specifically geared towards falls and fall preventions. And DQA, the Bureau of Assisted Living, they also have some great resources on their website. So, really look at what you are currently doing and how you can make an improvement or a change that's going to improve your outcomes. Continuous improvement protocols, put forward some kind of quality improvement initiative. Again, if you need help kind of coming up with a plan, reach out to me. Or if you're like, I am really struggling in this very specific area and I need support in this, do you know anybody that can help? Reach out to me. Most likely we do. And another important thing is making sure that the family and resident are involved and engaged. Review and update the care plan. Maybe you need to reevaluate the resident's exercise plan or nutrition plan. And the most important thing is transparency. It's hard to have hard conversation, and that can be a scary situation, especially after a fall, maybe a fall that resulted in injury, a fall that resulted in a hospitalization. Be transparent with the family. Understand where they're coming from. Be empathetic, and be clear. If something failed, it's okay to say that. You're not doing anything wrong. Meet them where they're at. Have that hard conversation, and let them know that you're working to improve the outcomes. That you do care for the residents that you serve. There is no shame in admitting that a mistake was made. And there is absolutely no shame in identifying solutions and updates and resolutions, being empathetic, and just reassuring the family that you are doing all that you can to care for their loved one. Honestly, just kindness, some customer service skills, and empathy will go a long way. You can't change what happened. You can only improve and make steps for forward improvement. And that's what you have to focus on. We practice a lot in our leadership academy about having difficult conversations. I don't know who's on this, but if you have ever participated in the one, it can be jarring. So if you ever need help with that, I love doing those exercises with people. So if you need to even just prepare for having difficult conversations, reach out to me. I can do a workshop with you and your staff to help improve your communication and how you relay information to the stakeholders that you work with. So to ensure that you have access to the information, I am sharing some of our NCAL resources. By way of your membership with us, you are also members of NCAL. So you have access to all of the information and tools and resources that are available at the national level. Clearly, they're a much larger organization than we are and have a much broader reach. So they have education and resources from workforce, regulatory, all aspects. So anything from provider operations, quality improvement, regulations, there are resources and educations available to you. NCAL hosts a free quarterly webinar for assisted living communities. You also have access to a customer relations, managing falls, and clinical tool. I'm going to see. This is, we're testing something out. If I click on this, if it'll open up. Let me see. Are you able to see the website that I just opened, or are you still on the slide deck?
We're still on the slide deck.
Okay, I'm going to toggle over here. All right, so Are you able to see this AHC NCAL provider resource screen?
Yes.
Awesome. This provides so much wonderful information. Um, and yeah, where will we start? Um, First, if you haven't already, log in. If you don't have login information, there's instructions. You can just contact NCAL. They will get you signed up if there's any issues. They reach out to us behind the scenes and we make sure that you are taken care of. First, these resources at the bottom: customer relations, managing falls, and clinical. So the managing falls resource item um, has a wealth of blogs, training tools, modules that you can review and look at, implement, share with your staff. There is a wealth of clinical resources and tools. Again, quality improvement, wonderful. And then customer relations, because obviously there you are in the business of also a customer service sector. And so it's kind of like, how do you effectively communicate what you do? There's a lot of good information about that. And another aspect is the long-term care trend tracker. Um, this tool, think of like the data that you get from WCCEAL, but at a national level. There's over 8,000 providers that participate in this. And the information that is included with this is wonderful. So since we are not a provider, we actually don't have access to this. I probably could get access, but again, we don't have data to support it. And we don't want to skew the numbers in any way. But it is an amazing resource because you have so much information available. So from an assisted living perspective, you can look at AL quality measures, turnover, retention, customer satisfaction. You can look at cost reports. You can even look at like survey data. You can hone it in, that uniquely. And they will kind of they can provide high level reports based on what state you're in, which is also neat. So there is all sorts of information. It's a tool that is super easy to use and can also help you kind of look outside the box, reevaluate what you're doing, how you're caring for residents, how you provide care. So do not forget to utilize NCAL when you're kind of like reevaluating your quality measures and your practices. So I'm going to go back to the presentation. Let's see. All right. So we went over the resources and the trend tracker. Another important reminder, the next quarterly Bureau of Assisted Living Forum is on October 15th at 10 a.m. The Zoom information is here. We will send out a reminder to you. You will have this slide deck. But obviously it goes over assisted living care rules, best practices, trends, public funding issues. You can also submit questions. So if you have a question, if you have a concern, if you want something addressed during the forum, you can submit it to this email address. They do ask that you include your email and phone number, just in case it is something that they can address with you immediately and work with you on privately. If there is any concern, if you do not feel comfortable sending it from your personal email address or your work email address, send it to me. I will submit the information on your behalf. I have no problem submitting wonderful questions, things that are inquisitive, things that may be a touchy or delicate subject. Send it to me. I will be more than happy to submit this on your behalf. But please participate in this. I like to participate in it. So again, add this to your calendar. It is a great resource for you to utilize. Okay, so some takeaways. When we look at moving forward, I want you to focus on accountability for the next quarter and establish a quality improvement plan for a 1% improvement in your fall rates. Because there is there's some concerns, right? We want to make sure that that rate and that trend doesn't keep going up. So take some accountability, see what can be changed, and establish an improvement plan. And we only want to see 1% improvement between now and next quarter. So maybe it is doing a root cause analysis and focusing on just one particular sector of the residents that you care for to see what can be done, and how you can change it. So once you focus on, everybody taking accountability for their own actions, you can then establish some changes. Oops. Let me see. Whoa, sorry about that, guys. Use the resources that are available to you. Again, you're going to get the slide deck, so it'll have all this information on there. Again, we have information, education, resources. Our national association has that information. Clinical Resource Center is a wealth of training modules and tools. Please use that. This is what this is for. We want to give you as much information as possible so that you can, implement that into your facility and utilize it however you best see fit. And please do not be ashamed or scared or weary of asking for help. We are here to help you. You can reach out to me. You can reach out to Taylor. Again, Taylor has some great pre-recorded information, so she can easily share that with you, whether it's just an overview of how to just log into the WCCEAL website and how to use that, how to view various reports, how to download various reports, because it's all to your benefit. So let me see if I can pull this up with my little, I don't even know if I'm still sharing my screen.
You are. We see like your computer background.
Here, I'm going to stop
Now,
sharing.
now I see nothing.
I have one little story I want to share that goes in with accountability. It's just a quick little reminder, something that you can even share with your team, because this can go a long way. It's a story about 4 people named everybody, somebody, anybody, and nobody. When there was an important job to be done, everybody was sure that somebody would do it. Anybody could have done it, but nobody did it. Somebody got angry about that because it was everybody's job. Everybody thought anybody could do it, but nobody realized that everybody wouldn't do it. It ended up that everybody blamed somebody when nobody did what anybody could have. So, that plays out what often happens in facilities when people don't take accountability. And it does play a crucial role in ensuring quality care in long-term care settings. And so think about that when you're just reassessing your care plans, fall prevention metrics and initiatives. Think about who plays the roles and what their responsibilities are, and ensure that everybody has accountability for the outcomes of your facility. Because obviously it is everyone's responsibility. So please be a role model. You can't tell people what to do if you aren't already willing to do it yourself. Don't make assumptions. I think the old saying about what happens when you assume something. So it's just set the standard of accountability, provide your staff with support and training, concentrate on what the solution is going to be, not what the problem is. If clearly there's an issue with falls, now let's focus on the solution, what the solution is going to be, and praise the performance and the changes that are happening. So to avoid having your team and facility staff become everybody, somebody, anybody, and nobody, commit to becoming the kind of facility that takes responsibility and brings accountability into your culture. And then you won't let anybody or everybody, somebody, and nobody stop you from doing what you need to do to continue your quality journey. So with that, I hope you have a wonderful day. Thank you for being patient with us as we navigated some awesome technology issues. Again, the recording will be out and available to you as will the slide deck. Reach out to us with questions, and I hope you have an amazing day and an even better week. Take care, everyone.